Hello, everyone. Greetings for the day. A very good afternoon to all of you. I'm Sankta from All About Skin Wellbeing. And I'm sure all of you must be doing good. We all know taking good care of our skin is important for more than just the appearance. As the largest organ, our skin becomes the most essential to our overall health. A fungal infection is quite common on our skin or nails or many times on our scalp. Fungal infections are diseases caused by a fungus. Mild fungal infection can look like a rash, it can be really itchy and annoying. So let's connect today with our skin expert, Dr. Archana Patil, who is joining us live from Mumbai to enlighten us on the topic of fungal management. Dr. Archana Patil is MBBS DNB consultant dermatologist and cosmetologist. She has rich experience in this field. She is currently practicing at Renova Skin Clinic, Titwala, Thane, Mumbai. A very warm welcome to you, Dr. Archana.
Thank you so much.
It's such a pleasure to have you with us, Doctor. And more importantly, because this is the season where we experience a lot of change in the weather. It's hot, it's humid, at times it's breezy at the same time. And of course, the number of cases of fungal infection uh, goes up. So it's important to talk about fungal infection. Before we go on with it, first of all, we would like to understand how fungal infection happens and which are the areas in our body which are, more at risk or prone to having fungal infection.
See, fungal infection is basically infection of the closed areas. So most commonly involved areas are the groin. Then we have the underarms, and we also have the buttocks, and all these areas which are most commonly the moisture or the humid areas. So these are basically caused, the infection is basically caused in areas, these areas is because of the sweating, the moisture, the humidity. So wearing of tight clothes and all these things often gives the concerns in these areas. Hence, once the moisture or humidity takes the place in these closed areas, the fungus starts growing and results into a kind of a fungal infection with a round, itchy lesion that can tend to spread over a long time if we don't take proper care on.
Hmm. Doctor, we see a lot of fungus, in various localities, like the outside fungus that grows in areas where the rainwater has accumulated, etc. So, why it happens, doctor, that in this particular season we see a lot of cases of fungal infection? Why this season is so, good for
Uh,
the growth of fungus?
See, basically in this season, which is a rainy season, we tend to get wet a lot of times. Okay. Second important thing is even the clothes and that we tend to wear. Some people wear jeans and everything, which is a thick clothing. So once you get wet or anything, these clothes don't dry off also properly. And or anything, the weather catches humidity or moisture very fast. So, as a result of this rainy season, but not only season, it is also the summer season because of sweating. These two seasons are more prone to cause infection in these areas, especially the groins and everything. So, commonly, these
Right. So wherever moisture accumulates, whichever body part is not airy, that becomes, of course, more at risk of having fungal infection. We always say, doctor, especially in medical field, that prevention is better than cure. Anyway, we can prevent having fungal infections.
Yeah, there are a lot of precautionary measures that we can take. See, thing is, we always tell our patients that please avoid wearing too tight clothing, especially jeans, thick clothing, leggings, and everything, because we have a lot of working population out here who wear such type of tight clothing for 8 to 12 hours. So that is one concern. So we can tell them to wear loose clothing. Then fungal infection, you should always use an antifungal soap. This soap should be used for a longer period of time. So that is another thing which you can do for precautionary measures. Secondly, since any person tends to sweat a lot, taking a bath twice a day and using an antifungal powder in the itchy areas like the groins the buttocks, the armpits, and everything. These on regular basis can help prevent getting fungal infection. And if you have fungal infection, it can also prevent the recurrence of the fungal infection. Another important thing is certain patients also have diabetes or certain other immunosuppressive diseases. So, in case they are taking any medicines also that is immunosuppressive, so in such cases also the immunity reduces. So these patients should also maintain their immunity properly, like a diabetic should always control their diabetes. Otherwise, recurrence of the fungal infection or frequent fungal infections can happen in them. So these are the main precautionary measures that we can do in such cases.
Right. So we need to follow these steps, these preventive measures to prevent ourselves from having fungal infection. And we'll also try to understand what to do when we catch a fungal infection. But before that, doctor, a very common practice in our society is to go for home remedies, to go for DIYs. We have various social media influencers on various social media platforms, and skin is one of their favorite topics. Even if most of them are not qualified dermats, they love talking about skin related issues. So they'll tell us something, apply this, apply that in case you have fungal infection. More importantly, most of the time as a layman, we don't know or we don't understand what is there, whether it's fungal infection that's affecting us or anything else, but we start self medicating. Over the counter topical application is again a big thing that we go for. I'm sure you also get patients who have done and tried a lot before coming to you. So what's your take? How
Mhm.
would you like to address these home remedies, over the counter medication, DIYs, etc.? Do they help in any way or are they more harmful?
See, basically, as far as this question is concerned, we have two, three things that we should remember. So the
Okay.
most important thing that we should remember is many a time people just tend to use creams that contain steroids. Okay, so steroids used in case of a fungal infected patient for the treatment of the infection or the TNA is very rampant here. But we need to know one thing: कि once you have got a fungal infection, we should use an antifungal. We are not supposed to use an antibacterial or a steroid because we are not justifying the treatment. A steroid just reduces the redness of the lesion and also reduces the itchiness, but it is not taking out the main cause, which is the fungus. So, just using the steroids is not going to help you by any way. Secondly, it is just giving you a relief for just a day or two. The moment you feel relief and you take off the cream, the fungus is going to come back rampantly. So actually, we have a lot of patients who come to us after they have used steroids frequently for months and months, and we tend to see it is very difficult to treat the fungal infections in such patients. Secondly, we need to understand ki what are the side effects of the creams which contain steroids. A steroid can cause thinning of the skin. It causes stretch marks. It increases the chances of frequent or recurrent infections. It can be anything, a bacterial or even a fungal infection. So you should always go for something which is actually going to act about the infection and not something that is just going to relieve out the symptoms. So this is about the steroids. So for that, you should always see a dermatologist because a dermatologist is the only qualified doctor that can guide you properly for a antifungal treatment after examining you in both by giving you an oral medicine as well as a topical medicine. Now, second thing that I have seen is many patients apply some cream containing dietronol or some creams containing like OTC products, just taking them
Right.
from a local pharmacy. But most of them undergo a reaction. As a result of that area can get a little redness, it can burn out. So that lands you also into major complications and it also causes a lot of scarring in that area. It can leave behind a pigmentation also. So again, I will repeat the same thing. See, there is no home remedy for fungal infection, and steroid is not the drug of choice. So you should always see a qualified dermatologist, get a proper treatment advice from him, get it completed, and get completely cured of the infection on the basis of preventive measures.
Right. So it's very, very important, A, not to go for any home remedy DIYs or over the counter topical application. B, go and consult a qualified dermatologist, a board certified dermatologist. C, complete your treatment. That's equally important. Now, coming to that point, doctor, complete your treatment. Again, we Indians, we feel that, okay, if you have prescribed me medicine for, say, 1 month, I'll religiously follow it for a week. And as soon as I start seeing some relief in the symptoms or signs, I'll stop it. I won't even inform the doctor. I myself will, qualify as a doctor in that case. And we do that. And again, we see the signs, we'll again start the medication because now we have the prescription. So, again, how would you like to address this? Is it the normal to do practice, or as you said, completing your treatment is very important? Why it's so important in case of fungal infection?
Yeah, see, basically, there are practical reasons for this. The number one reason is fungal infection is not restricted to just one area. You can get fungal infection of the scalp, you can also get fungal infection of the groins, you can get it of the underarms, and it can spread to any part of the body. Though the earlier areas are very common one. So, depending upon the examination, the days of the infection, the areas concerned, there are some drug norms on how many days the treatment should be taken. So, if you're not completing that day's treatment, for example, if somebody has a fungal infection of the nail, then the fingernail, the treatment can go on for many months. If somebody has fungal infection of the hair, the scalp, the treatment can go on for 2 to 3 months if he is having a groin. So, it is not just one single dose or one single medicine that we are just supposed to take the course. Secondly, there are different antifungals available in the market, so that also depends on the examination and the response you're giving. And another important point here is the side effects. Only a doctor knows ki how many days you can give someone a medicine that cannot land him or her into a side effect. If we keep on taking the medicines every time I get it, I might tend to damage my liver, I might tend to damage my kidney. So a doctor is the right person to tell you, okay, you are supposed to take it for 2 weeks. Then you come back, then we change the dose depending on the response. Then we need to take it for 7 days. So self-medication should be avoided as every drug is associated with some grade of side effect and can hamper any system of your body too.
Right. So, and again, doctor, we see a lot of cases of resistance or recurrence in case of fungal infection. Do these, small mistakes that we commit, like not going to a doctor or doing self medication or not completing the dose, etc., they lead to such things?
Yeah, see, as I have already told before, one needs to adhere by the treatment completely, get the course completed as advised by a qualified dermatologist. Okay. But second important thing is ki we should understand ki if we are having any underlying disorder or like diabetes that I give you an example or something else, we are taking any other medications for that. So even that this disorder should be kept under control. Thirdly, important is, as I told you, rampant use of steroids. Rampant use of steroids causes frequent infections a lot. Patients just take a tube, over the counter tube, keep on applying it again and again for months and months. And then they keep on come to us and tell us, I have this infection from 2 years, from 3 years. When we ask them, actually, yeah, they're using this tube from so many days. So again, go to a proper qualified dermat. Don't buy these OTC products that are just give you a temporary relief. And the most another important point that I would like to focus is again the precautionary measures. So the treatment of a fungal infection does not stop just with the course. You have to continue with the precautionary measures because if you are doing a job that is going to cause sweating, if you are doing a job which is going to cause humidity, if you're working somewhere that you have to be in contact with water for a longer period of time, so these precautionary measures like using an antifungal powder, taking a bath twice a day, wearing loose clothes, changing your clothing at least twice a day, using an antifungal soap. All these can prevent the frequent infections or the recurrent infections that we are often facing because of the fungus.
Right. We need to follow the preventive measures throughout, no matter what weather is, but still we need to follow it so that recurrence of fungal infection doesn't happen. And of course, other things are definitely there. Now, doctor, when a patient comes to you with such signs or symptoms, are there any tests that you normally recommend, or just by physical investigation, you're sure that, okay, this is fungal infection, this much has it, spread or gone underneath?
See, there are two things. One is the definitive diagnosis is basically a clinical diagnosis. So once the doctor sees you, once he sees a red lesion, which is an itchy round lesion with a clear center, and the typical areas that are causing it. So a clinical diagnosis is gives you 90 to 100% telling you okay, it's a tinea or a fungal infection. But in certain cases, sometimes the typical infection cannot be seen. It could be because of the known reasons like home remedies or the use of steroids or use of any other medicines. In such cases, yes, we can do a KOH test, which is a lab test. This test is done where we take a little scraping from the areas where the infection is there and it is examined under the microscope. So once we see the fungus, a definitive diagnosis is again made and then the treatment accordingly is started. But testing in a lab is rarely done only in very, very unresponsive cases or if they are associated with some other underlying condition.
Okay, fair enough. Now, we would also like you to shed some light over the treatment options available for skin related fungal infection and how much time it normally takes to heal.
See, as I have talked before also, the treatment often decides upon the area concerned. So if somebody is having infection in the groin, the buttocks, or the waist, then the treatment can take 3 to 5 weeks, and the dosage or the drugs depend on how the lesion is. We have basically we have two types of treatments. We have oral treatments and we have topical, which means the creams, the lotions, or the gels that we use to apply. Okay. So oral drugs depends upon after examining the patient. We have azoles in the market. We have terbinafines in the market, TCO5 in the market. So depending upon the region that is affected, the extent of the disease, if the patient is having any underlying condition, a oral antifungal is always a part of the treatment. So if anybody is having in the groin, the treatment can go for 3 to 5 weeks. If anybody is having in the scalp, that is in the hair, then the treatment can go on for say even 5 to 6 weeks or even more. If somebody is having infection of the nails, fingernails for 6 to 8 months, then toes, the treatment goes on for even sometimes 12 months. There are various cyclical doses. So, depending on the area, the treatment goes on. Second is about the topical agent, that is the creams or the lotions. So, we have various molecules available in the market like Cebifin, then we have terbinafine, we have laliconazole, we have ibuconazole. So, there are various topicals available in the market. So, a combination of these creams as well as an oral drug that the doctor prescribes after proper examining, deciding the duration depending on your response is how we go ahead with the treatments. But again, I would like to focus ki though we are giving a doctor is writing down a prescription, preventive measures should start from the day one and should go on or should be inculcated in our lifestyle so that we don't get a recurrent fungal infection.
Absolutely. And doctor, we would also like to talk about nail-related fungal infection. Who all are at risk of having a fingernail or toenail-related fungal infection, and how to take care of it, and how to deal with it, etc.
See, nail fungal infection commonly affected people that we come across are basically housewives because they do immerse their hands in water for a longer period of time that creates moisture, like while cleaning the vessels, the utensils, while washing clothes. Then we have certain people who go for swimming. They also tend to get infections of their toes, fungal infections of their toes. Then we have people who are on long-term, long-hour jobs, like 8 to 12 hours, and have to wear tight shoes along with socks. They tend to sweat inside in between the toes, so they can also get fungal infections. And somebody is who is having fungal infection on the rest part of the body for a very long period of time can also get fungal infection of the fingernails. One should remember these things, especially females. They use nail paints,
Hmm.
they do pedicures, they do manicures. So,
Right.
the treatment or the beauty procedure that we are doing, we should take care that the instruments that are being used, they have been sterilized and they have not just been soaked in water and used back from somebody who already has a fungal infection. So, these things
Right.
should also be taken into consideration.
Okay. And doctor, we would also like you to tell us about scalp-related fungal infection. Again, who all are at risk and how to take care of it.
Scalp-related fungal infection basically we see in most of the children's actually. This commonly
Okay.
seen in kids, and these infections tend to spread very easily in schools or in overcrowded areas because they tend to use the same combs, they tend to use the same what do you say, the same clips and everything, the hair clips, so they can
Hmm.
easily spread to such areas. It is also seen a lot in small babies because of the oil massaging. Sometimes the massages are done for a long time, very frequently. The oiling again can cause a little moisture humidity and can result into it. We also have many males, especially some females. They do use helmet and have long hours of riding or driving. So in such cases, because of the sweating of the hair, also it can result into a fungal infection of the hair follicle or the scalp.
Okay. Now, doctor, as you said, oiling in small kids or infants can also lead to fungal infection. What happens, as adult also, or in our society, we are also obsessed with oiling of the scalp, and especially in children, will keep the oil on their scalp for longer duration of time. We won't let them wash their, hair that often. So, what's your take on oiling of the scalp, connecting it with fungal infection? In case, I mean, we have this concept: if we see dandruff, if we see dryness of the scalp, we may don't know that whether it's fungal infection or dandruff or anything else. But the only treatment that comes to us very easy is to apply oil. So, does oiling gives a good atmosphere for the fungus to grow?
Yeah. See, the two things that we should know. See, if the scalp is oily, a fungus will tend to nurture over it. because the fungus requires oil for its growth. And if the scalp is already oily, and if we are on that applying more oil to the hair, we are not doing any justification to the scalp. So, in fact, it is just a cosmetic thing that people feel after applying oil, my dandruff goes off. There is no
Hmm.
such concept. In fact, dandruff is also a fungal infection, and you
Right.
are just settling it down, you're nurturing it. In fact, the moment the oiling goes off, you might tend to get more dandruff. Another important thing is the people use nowadays a lot of conditioners, and they also
Hmm.
use masks for their hair. So actually, the right way of applying these is 1 to 2 inches away from the scalp. If you're applying them on the scalp,
Hmm.
then it is again going to cause moisture, humidity, result into dandruff, and then the circle goes on. And some people in our society, especially, have the habit of applying oil to the scalp. But we always
Hmm.
recommend they can just apply it half an hour before washing off their hair and just wash it off. So that will not even result in dandruff, because if there's excessive dandruff, it can even come on your face, um, around your nose, on your ears, and again cause fungal infection.
Right. So we have talked pretty much well about skin-related, nail-related, scalp-related fungal infection. Now, doctor, if a pregnant lady is, infected with with fungus, what is normally the line of treatment? Because we know over-the-counter medication is a big no-no in case she is pregnant or lactating. So, what are the things that, as a doctor, you keeps in your mind?
See, here, as a pregnant lady, it also depends on what month of pregnancy or the term she is. Second
Okay.
important thing is, as you all know, see, a fungal infection is often associated with itching. So, in such cases, we often allow symptomatic treatments to the patient by giving them itch reliever or an antihistamine and treating them with an antifungal soap or a topical or an antifungal cream or a gel. So we basically avoid giving oral antifungals, as most of them are not so tolerated in pregnancy.
Right. I'm getting a lot of questions from the viewers' side, so I'll take few of them. Shashi Soni is here, and Shashi is asking, can I use the old cream that was prescribed by the doctor, or I should take the new prescription?
Hi Sashi. See, there are two things. One is which cream are you talking about? Secondly, if you're talking about an antifungal cream, and how many days have you opened that cream? Because any medicated product cannot be opened and cannot be used for 7 months, 8 months, or even a year. So it has a specific quantity, like say 20 gram or 30 gram, that needs to be finished off, say, in a month or so. And if the product has been kept open for a longer period of time, of course, we advise it is better to go to take a new product rather than using the same product. So always go on for new product and try to finish off the products within a month or 1 month and a half, and not keep it for a longer period of time, because the effectivity of the product reduces a lot.
Right. There is Amit Jatav, and his question is, what should I do if the itching is unbearable?
If you are getting itching because of the fungal infection, as I have told before, the main line of treatment remains the cause. So we have to start an antifungal. So your first step would be to go to a board certified or qualified dermatologist, get yourself examined, and start with an antifungal that the doctor suggests. Yes, as the itching is already associated with the infection, we often advise or often tends to give an anti-itch medicine along with it. But we are not supposed to treat the symptom. So the itching is not the main culprit. We need to treat the fungal infection. So again, just taking an anti-itch tablet will just relieve you of the itching, but it will not take off the fungal infection that is actually causing the itching.
Right. Tina Bhargav is here. Her question is, I share my makeup products with my friends. Can
Hmm.
this be one of the cause of fungal infection?
Yes. See, same applies as I replied for the creams. Any makeup product cannot be used for more than a year. That is one thing. Secondly, you cannot share your makeup because and the makeup brushes or the makeup kit that you're using because when somebody is using those makeup brushes and if they are not being washed properly, they could be infected with the fungus. And you using the same makeup and the same makeup brush as somebody who has got a fungal infection can give you a very good fungal infection too. So, keeping or restricting your makeup only to yourself, not using anyone's makeup, regularly changing your makeup. Secondly, regularly washing your makeup brushes. All these things are very important when we are doing a makeup, and nobody should use or share it with anyone.
Absolutely. And we see a lot of moisture in whatever makeup applicators we use, a sponge, brushes, because, our makeup products are also at times liquid or like that. So, in that case, you need to wash them, dry them properly. And of course, sharing is in this case not caring. Because she asked about makeup sharing, doctor, I would also like to add to it. For example, there's a family and one of the family members is infected with fungus. Now, what are the steps that others need to follow so that they don't catch the infection?
See, basically, anybody with a fungal infection, we often tell them to keep all their things separate, like keep their soap separate. So, a soap should not be shared by others too. Secondly, their towel and everything should also be kept separate. Their clothes, if they are having too much of infections, entire all clothes should be washed separately by soaking it into hot water. Thirdly, try to keep everything as much separate as possible because there are very good chances that infected towels or like infected makeups or makeup brushes or infected clothing can tend to give or transfer the infection from one person to another.
Okay. Deepak Saxena is here. His question is how to protect our feet from fungal infection in this monsoon season.
Um, I basically recommend all of my patients who have infections of the feet uh, to use antifungal powder. We have many patients who go for longer jobs, they wear shoes, socks. So I always tell them to use an antifungal powder in between the toes at least once or twice. Secondly, always wear cotton socks so that even in case any sweating or moisture happens, it can get absorbed by the powder as well as the socks. Try to use as much as open footwear, especially in rainy season, because suppose if you get wet or the footwear get wet, then sitting with them for a longer period of time can also cause you a fungal infection. So try to aerate your feet as much as possible so that you don't tend to get fungal infection.
Right. John Vargas is here. His question is I go to swimming pool and I have heard that you can catch fungal infection from pools as well.
See, basically there are two things in this. One is the water that is used in the swimming pool. So, if the water has been regularly cleaned, it has been disinfected, it has been chlorinated, then it should not happen. But if the swimming pool that you're visiting is not giving you this kind of a clean treatment, is not having which the water is not being changed for a long period of time, then there are high chances that sometimes you can tend to get fungal infection. That's all. But one more thing is if you're been in water for a longer period of time, be it swimming and all, you need to take a proper shower after that, get yourself cleaned, get yourself dried, use a proper powder, antifungal powder after you have taken a proper bathing. These all will not land you into all these fungal infections then.
Okay. Feroz Khan is here. His question is: does fungal infection affect internal organ?
Uh, there is something called as a deep fungal infection. So sometimes it can cause, but that kind does not affect any kind of internal organs like the liver, kidney, or the heart or the lung. Yeah, sometimes we have a type of a fungus that affects the lungs also. But they are very rare conditions that happen. Somebody is getting exposed to pets for a long period of time. Somebody is already having asthma or some other lung disorder. Or if somebody is in contact with birds, their pollens and all. So that can sometimes give you fungal infection of the lung. Yeah, but one should remember is the treatment of the fungal infection. So the tablets and everything of the fungal infection, if taken without proper medical advice from a qualified doctor, can land you up into side effects of the internal organs, especially of the liver and kidney.
Kidney. Right. Doctor, before we sum up the whole session, any take home message for our viewers?
Yeah, sure. Again, the same repeating one. One is please always see a qualified dermatologist before you get your fungal infection treated because fungal infection requires special attention, special treatment. Second important thing is do not self-medicate yourself, especially with OTC products and the steroids. Third is, though a doctor treats your fungal infection, you have to maintain it by the various precautionaries or the preventive measures. So, all these things are a very important take home message for everyone to get free of yourself from the fungal infections.
Absolutely. Thank you so very much, Dr. Archana Patil, for your valuable time. It has been quite an informative session for our viewers, and we really look forward for many more such sessions in coming times with you. Thank you so very much once again.
Thank you so much. I thank everyone for giving me this opportunity. I'm really obliged. Thank you once again.
Thank you, Doctor. And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.